It is a health center located at the heart of several communities in the Sola Tuna Kaba district of the northern region. The survival of patients in these communities hinges on the health center. Yet this health facility boasts of only one microscope, which they depend on for proper diagnosis of their medical conditions. I'm referring to the Good Shepherd Health Center. On JoyNews agenda today, JoyNews correspondent Rafiq Salam, who visited the facility at Tuna, reports the facility is also without scanners for pregnant women.
This is the Good Shepherd Health Center, located at Tuna in the Sola Tuna Calabar district of the northern region. It is strategically located at the heart of the district, and for that matter, the preferred choice of clients in the district and beyond. It serves a projected client population of 37,000 people. However, it is poorly resourced and under-equipped. This health center has a small laboratory in a small and obscure corner of the facility. The technicians here say this lab is the nerve center of the clinic, but the only equipment here is an old microscope. In fact, the survival of these patients, most of whom I see lying on the ground and in pains, depend on proper diagnosis of the medical conditions. Pora David is the assistant laboratory technician in charge of the health center.
We have a centrifuge, and actually because of we don't have the equipment to run some tests, we cannot do only the microscopy and then the centrifuge. And we actually need something we call dryer. When people come for the lab, they delay because of we don't have dryer. When we take the sample, instead of to dry the tin and apply our Jamesa to run the test very fast, they cannot do it because we don't have dryer for that test.
The lack of basic laboratory equipment like scanners at the facility put the life of pregnant women at risk. Juliana Yelviana Bayire is the midwife in charge of the facility. She is worried about the increasing rate of maternal deaths in the facility as a result of the inadequate medical equipment.
You see a pregnant woman carry pregnancy from 0 to 9 months without scan. She doesn't know the number of babies that are inside. She doesn't know her status. And these days there are so many infections. So if the woman comes in labor without those things, you, the nurse attending to the woman, you are at risk. If the NGO or the government can help us upgrade this place to a polyclinic, at least all those things will be put in place. The scanning and lab investigation, all those things will put in place so that it will help us and help the women as well. Anything can happen. You can be infected.
Over here, all the laboratory tests are done in the full glare of the patients who are seated close by. Due to that, 61-year-old Tamanzua Takora Paul says he is uncomfortable anytime he is to undergo any test at the laboratory.
In lab is a secret in place, and even I will say a hidden in place. But as it's open like this, even someone can stand outside and then look at you and know what you are doing, which is not on the right channel.
The cubicle is partitioned with board to enable it to perform a dual role, first as a palpitation room and second as a labor room.
This small cubicle in which we are, that is our palpation room. There's no space. You can see that we use a board to partition it so that we'll be able to attend to the pregnant woman. Another challenge is our infrastructure. It's also a problem. There are some NGOs that gave us some equipment which the people need and the facility needs to use, but because of the lack of space, we cannot use them. Those equipment are lying down.
Which equipment are you talking about?
They gave us baby warmers, cylinder concentrators, a lot of them. They are there, but we can't use them because there's no space for us to put those equipment down.
The situation is not different at the ANC ward, where pregnant women receive antenatal services. 3 months ago, the roof was ripped off by a rainstorm, and it has still not been fixed. Administrator of the hospital Augustine Luktitiwe appealed to the government and other benevolent organizations to come to their aid.
The places that were already expanded, taken off by the roof, it has extended to other units like the OPD, which initially was not much affected, but now it has extended to that portion, and we are afraid as the rains continues to come in. We wonder maybe the next few months of the year whether we can really provide services for the people of Tuna. Looking at the threshold of the community, about 37,000 population, which is a great number, and a lot of clients who travel far and near to attend to a facility are not able to get some services, and that has been a great worry to us because majority of the people who live in this community are very poor that they are not even able to meet the three daily meals, and that is really affecting them. If they come to this facility and then they are asked to refer them to another higher facility, they retreat back and go back home because they will not really afford the transportation cost to the next higher facility for service delivery.
Access to quality health care is a critical need for people, no matter where they live in the world. But in this part of the world, quality care is almost becoming a privilege. Reporting for JoyNews, Rafik Salam, Tuna.